So we know that 25% of kids in Baltimore City are chronically absent, and the #1 reason for that absenteeism medically is asthma, poorly controlled asthma. But we also know, as healthcare providers, that asthma isn't a reason to miss anything. With the proper management and the proper adherence to your medication, there's no reason for you to miss a day of school.
Pediatric asthma really is an equity issue because it drives a lot of health disparities, particularly for children of color and particularly for poor children. It also drives a lot of educational disparities. So kids who have uncontrolled asthma are much more likely to be absent from school, and then they not only have to deal with adverse health outcomes, but potentially adverse educational outcomes.
Our program, Breathe, Baltimore Realizing Equity in Asthma Treatment in Health and Education, takes a really simple model that was developed at the University of Rochester and applies it right here in Baltimore City.
At the Rales Health Center, the fact that they can give asthma controller medicine, so the medicine that a kid needs every day to help them control their asthma in school, that means I know that kid is getting that medicine that I prescribed on a daily basis. They're not only getting it, but they're learning how to take it, the importance of taking every day, and getting all the education along with that. That's one less kid that I worry about having their asthma under control.
A pediatrician works with the family to determine if school administration is the best way for their child to get their controller inhaler every day. The doctor prescribes the inhaler and fills out a form for the school health staff. The inhaler gets delivered to the school, or the family picks up the medicine and drops it off. Each day, the student comes to the nurse who administers the inhaler, along with some personalized education. Once a month, the nurse uses the asthma control test and communicates back to the doctor and family with any concerns.
Before I started taking medicine at the Rales Center, I was wheezing a lot, and I had a lot of chest pain, and I had to leave out of class. But now, they make sure I take my medicine every day, and it helped me a lot, so now I can play lacrosse and I can dance.
We were always in the ER or the urgent care center because he wasn't on a regular regimen. But since he's been here about a year, we no longer have been in the ER. His medicine is regulated. He's doing great. He's able to go outside, run and play. All those type of things that neighborhood kids are able to do, he can do as well.
There was one year I rode 30 times to the hospital with children that had asthma attacks. The last few years of the asthma project, I've done that 0 times. So I definitely think we're seeing that, one, our kids are having healthier school experiences because their asthma is better managed and their parents have the support to manage it better. And then we're also seeing that it's positively impacting kids being in school and at school on time because they can get the support they need for their asthma treatment here without their parents having to pick them up, take them somewhere else, and aren't able to get them back to school.
This model really capitalizes on the power of school nursing and helps nurses move their time from reactive, treating children in asthma exacerbation, to proactive, preventing those exacerbations.
I play lacrosse, basketball, I did track, I played street hockey, and captain of the dance team. I just did everything. Asthma is not going to stop me from anything.